who is currently the director of the Technical Assistance and Training Branch. As part of the leadership staff, Natalia works on several initiatives, but focuses on the Alliance's Creating Pathways to Hope and Healing Polyvictimization Initiative, funded by the Office for Victims of Crime. Her previous work in developing and planning for family justice centers in the United States and Mexico have given her a unique experience and understanding of the impact of family justice centers and similar multi-agencies have on the lives of survivors and their children. Alliance for Hope International has received national and international recognition for its innovative and systems-changing work around its 5 core programs: Family Justice Centers, Training Institute on Strangulation Prevention, Camp Hope America, Justice Legal Network, and its Voices Survivor Advocacy Network program. With 137 identified centers around the United States, Alliance for Hope is beginning to redefine and shift how communities and professionals prevent, intervene, and collaborate around the issue of interpersonal violence through evidence-based practices like family justice centers.
Thank you. Well, thank you again all for being here to talk about such a critical public health epidemic and a public safety issue that's truly important in our country right now. Interpersonal violence, as you all know, is not about those people. It's about our neighbors, our mothers, our fathers, our brothers, our sisters. And it sees no racial boundaries, economic differences, or religious affiliation. It's something that not only impacts us now, but it impacts us for generations to come. And I'll, as Becky mentioned, give a brief overview about the work of family justice centers across the country. But as we always do at Alliance for Hope International, we begin every presentation honoring those who have lost their lives or their loved ones to domestic violence. So just to put this into perspective, from 2001 to 2012, 6,488 American troops were killed in the wars in Iraq and Afghanistan. During the same time, 11,766 women were murdered by their former or current male partners. That equates to about 3 women being killed a day by a male partner. Today, we honor some of the women who were murdered this January 2017 because of domestic violence. Alyssa Kinsall from Panama City, Florida, Khadijah Clinton from Charleston, South Carolina, and Luann Anderton from West Valley City, Utah. And at the same time, we want to recognize law enforcement officers who risk their lives to protect us and our communities. Domestic violence calls lead to more police fatalities than any other type of call. Out of 91 cases of police fatalities that occurred from 2010 to 2014, 22% of police officer deaths occurred when responding to domestic violence disputes. Similarly as shocking, 2 out of 5 mass shootings from 2009 to 2012 began with a gunman killing a girlfriend or a wife. And as we've seen in recent events in Orlando and Fort Lauderdale, we begin to understand the history of violence against women that both of these men had as well. And data and research in the field demonstrate that domestic violence homicides are predictable. And if they are predictable, it must mean that they are preventable. Since 2002, family justice centers have demonstrated just that, the power of collaboration. And they have become beacons of hope in our community and are an evidence-based homicide prevention strategy. So what exactly is a family justice center? So here's the easiest way to kind of break it down. So some of you may remember when we had boom boxes and Walkmans and Discmans to listen to our music, and you had calendars and alarm clocks to schedule your time. And then for cameras, you had Polaroids, and then you had video cameras, and eventually we all got the digital camera that put those two together. Well, one day along came the smartphone, and it put all of these different tools and technologies into one place. Well, that is a family justice center for victims of interpersonal violence. A family justice center are the smartphones of the movement. And we also want to recognize, of course, the long and arduous work of those who came before us. Family justice centers are the product of the shelter movement in America in the 60s and 70s, and we honor the feminist movement who pushed to change laws, created community response teams, and advocated for monumental federal legislation such as the Violence Against Women Act. It's through their critical and foundational work that family justice centers came into existence. So in 2002, the first Family Justice Center opened in the city of San Diego by then City Attorney Casey Gwynn and Family Justice Center Director Gail Strack. They were serving over 1,000 survivors and their families a month, and word quickly spread of this phenomenal work being done to prevent homicides and reduce recidivism in the city of San Diego, catching the eye of President Bush's administration. Then, in October of 2003, President Bush announced the President's Family Justice Center initiative, which provided more than $20 million to open the first family justice centers in communities across the country. But since then, the Family Justice Center movement has expanded greatly. An environmental scan funded by the National Institute of Justice demonstrates that there are over 137 family justice centers and similar multi-agency models across the country. Alliance for Hope International estimates that about half of these centers are coordinated by shelters and community-based domestic violence and sexual assault agencies, and the other half are coordinated by public agencies such as district attorney's office or police departments. Family justice centers exist in rural, suburban, urban, and tribal communities across the country, uniquely reflecting the needs of their communities. Family justice centers serve survivors of domestic violence, sexual assault, child abuse, elder abuse, and human trafficking. And they are really rooted in the belief that to break the cycle of violence in the person of one life, or one person, let alone several generations, Maslow's hierarchy of needs must be met during service delivery. And as you all may well know, the basic principle behind Maslow's hierarchy of need is that you cannot address people's needs of belongingness and self-worth and hope, which are at the top of the pyramid, without first addressing their basic physiological needs like safety, security, connection, support, community. And under one roof, family justice centers do just that. They provide crisis intervention to address those physiological needs, and they also focus on the holistic needs of survivors. Through advocacy, counseling, legal help, medical support, health and wellness, job training and prevention, survivors and their families are wrapped in support and services, increasing the chances of changing their outcomes and breaking the cycle of violence. And we are informed by evaluation. Since 2004, family justice centers have been pushing for research that shows the effectiveness of their work, from changes in prosecution outcomes to survivor-defined success, to reduce numbers of domestic violence calls, to increase collaboration and positive systemic changes for survivors, their families, and communities at large. And here are just some of the research that's come out about family justice centers. This is an independent evaluation conducted on family justice centers in California. And using a mixed method data collection strategies, they found that access for survivors was supported in 5 ways. First, it was easy for survivors to come to the Family Justice Center. When they arrived, they received high-quality services, and survivors, once at the center, felt supported, encouraged, welcome, protected, safe, comfortable, and they were not treated like numbers. And because Family Justice Centers connect the criminal justice system with community-based agencies, survivors came into contact with knowledgeable staff, leading to a smooth transition in Family Justice Center services. Finally, survivors felt family justice centers were helpful because they do not turn anyone away, they have food available, easy parking and transportation assistance, and they're located all in one central location. And the numbers really speak for themselves. In 2015 alone, Brooklyn Family Justice Center has served over 29,972 survivors and their family. Before opening the Family Justice Center in 2002, Brooklyn had 36 domestic violence homicides. After opening the center in 2005 and seeing the success, Mayor Bloomberg at the time and his Office to Combat Domestic Violence funded a borough-wide Family Justice Center initiative. Since then, domestic violence homicides in Brooklyn have dropped dramatically. In 2015, there were 3 domestic violence homicides in a city with a population of over 2.5 million people. That is a 91.67% decrease since 2002. And these statistics carry in other cities. In San Diego, we've seen similar trends in declines in domestic violence homicides since the opening of the Family Justice Center in 2002. We've also seen a decrease in domestic violence jury trials. In San Diego, before the Family Justice Center opened, there were 81 jury trials for domestic violence crime. And in 2003, just 1 year after the center opened, that number was down to 24. And as I mentioned previously, Family Justice Centers have also led to systemic changes in our communities. Though this report was not intended to focus on mitigating factors to police bias, advocates identified co-located advocates and police officers, multidisciplinary teams, and specifically family justice centers as critical ways to mitigate police bias around the country. However, the effects of violence do not only impact the victim alone. It's felt for generations to come. The National Youth Survey Family Study sampled 1,683 families and followed 353 second-generation parents and their third-generation offspring over a 20-year period, and they found that 75% of families experiencing domestic violence will have a child who becomes a victim as an adult. Similarly, 78.6% of families experiencing domestic violence will have a child who becomes a perpetrator. These statistics are grim, but family justice centers have found ways to mitigate the impact of this trauma in multiple generations. Remember when we were talking about Maslow's hierarchy of need and the goal to reach the very top, which is hope? Possibly the most meaningful work of family justice centers has been documenting the scientific changes in hope in survivors and their children through thoughtful and intentional programming in our centers. Hope is the single most important predictor of long-term outcome in the lives of our survivors. High hope people navigate their way through trauma better than low hope people. Using the validated hope index, we measure hope before and after we work with children and adult survivors of violence and abuse. As we finalize the research for 2016, I'll share with you some of how Family Justice Center programs like Camp Hope have been incredibly effective in building hope and resiliency in children who've been exposed to domestic violence. So other than being a ton of fun, as you can see here, it has allowed children to connect with one another and helped improve their self-esteem. And here we have some pictures of what kids do at Camp Hope. So you see some mindfulness and yoga, some community building, lots of cheering, rafting, rock climbing, horseback riding. They have a challenge course as well. But here's some of the data. So as I mentioned before, the validated hope index is conducted before camp, right after camp, and then 30 days after camp. And we see that children who participate in Camp Hope had a statistically significant change in their level of hope. Leave that there for that picture. There you go. And this also includes statistically significant increases in resiliency. This year, this research was published in the Child and Adolescent Social Work Journal, further demonstrating the evidence-based practices and effective programs implemented by Family Justice Center communities across the country. So it's through this comprehensive and holistic work that Family Justice Centers continue to change the outcome for survivors, their children, and bring hope to communities. I think that's it. We have some time for questions?
Yes, we have about five minutes or a little more for questions.
Yes. What have been some of your most successful recruitment techniques to get people to come to these centers? How they work?
Outreach. Well, the most successful, as we all know, is word of mouth, of course. And so we always say that survivors vote with their feet. So when you have great services that are wraparound services, survivors usually spread the word by themselves. And this is particularly true for immigrant communities, especially undocumented immigrants, where family justice centers are safe and really built in a way to honor them and be holistic and provide holistic services. We see that clients come back and they don't only come for crisis intervention, but they come back and forth. And so a lot of it has really been just grassroots word of mouth. Yeah. Yes.
So you said hope is a single most predictor of long-term positive outcomes?
Yes.
Did you do further analysis on what those outcomes, what kind of strong relationship it has with other outcomes?
Sure. So there's actually an entire field of research around hope. The University of Oklahoma and Dr. Chan Hellman there really does a lot of work around hope and resiliency and what that means for long-term outcomes. We just started our Camp Hope study in 2014, and so we're starting to see what that looks like, and we've actually added a new component this year, which is a year-round mentoring model to go along for the kids who started Camp Hope. And so I hope to have research for you in the next year, but what we've seen is that really it helps mitigate the impact of violence, and the idea of hope is that you have the agency and a pathway to get to your goals, and we know that that's a strong predictor of being able to navigate through trauma in the future.
Any other questions?
Are there FJCs in all 50 states?
Not yet. We're working on that. Not yet, I know. But there are some states that are now starting statewide initiatives, which are really exciting. So we know New Jersey is starting one. California has about 17 family justice centers up and down across the country. The city of New York has 5, going on 6, I believe, in all of its boroughs, and they're starting to open some, expanding, but not all states have family justice
Are
centers.
they privately funded? What? Why aren't they? What? Why?
That's a great question. We can talk about that. So family justice centers are funded in different ways, and I mentioned that's kind of the hard part about talking about centers. They're also uniquely made, and some are nonprofit organizations that receive support from their local government. Other are funded completely under their local government. So for example, in San Diego, it's actually part of the police department. It's considered a program of the police department. But in other communities, it looks very differently. So local government support is different. And on a national level, we do receive funding from the Office on Violence Against Women. Yes.
Does the predictive power of hope vary by age group or by gender or in general?
Not that I know of. And what's interesting also is we use a lot of average childhood experiences, the index, the ACEs. And we've seen that people who actually have higher ACE scores tend to have higher hope, which is really interesting, and it's something that we're starting to delve into a little bit more. But we haven't seen any specific differences between ages or gender and their level of hope. And we do also know that hope changes throughout your life and really depending on where you're at. And so some of that is, again, building some of those protective factors and coping skills to be able to kind of handle and mitigate the trauma that's occurring throughout your life.
Thank you.
Mm-hmm.
Considering the fact that hope is not in all over the country, do you have any restriction with regard to hope and seek for your help? Do you have to belong to a certain county or certain state?
That's a good question. The only restriction is that we don't serve perpetrators on site. So it's a victim-centered approach. So we will only serve victims of interpersonal violence. We are looking to create a similar model for perpetrators, but at the time, because of power and control dynamics, we don't serve perpetrators on site. And no, there isn't any restrictions as to who can access Family Justice Center services unless it's dictated by maybe funding and specific programs, but for the most part, they're open to any survivor who comes in to the center.